I'm an only child. I grew up in upstate New York. As a kid, I was one of these folks who always thought that I needed to make the world a better place, and I didn't know how I was going to do that. I do recall as a high school student spending time in the operating room with one of my dad's friends who's a urologist. I was drawn to medicine because of my love of science and desire to help other individuals.
My mom was a psychiatrist in the former Soviet Union, and I was about 5 years old when one of her friends developed a schizophrenia, and somebody asked my mom to see that woman in our home. And my mom, after talking to her, came to the kitchen and she was crying. I remember that, and I was watching her and I was thinking, this is what people do to help others. And that was my first introduction to medicine.
I am an acute leukemia physician. I have an active clinical practice taking care of adults with acute leukemia.
There are a lot of challenges in being a leukemia doctor. Personally, I find the most difficult situation when I do not have a treatment option available for the patient.
Yeah, it was one of the worst days of my life.
I had no symptoms going into this. It was totally unexpected, and it was like my world fell apart.
I can't even describe to you in words what I felt.
What I find so most rewarding about my job is the relationships that I develop with my patients and their families. It is an incredibly intimate relationship. I hear about their fears and their goals, their aspirations, and their concerns.
When you have a cancer, when you're married, and when you have a child, it's totally different. You don't think yourself, and you just think of wanting to be around more. Take my son to school, pick him up, playing with him, or going out with my husband, just like every other person would do.
Every time Dr. Altman or Dr. Frankfurt came to my room, it made me feel like I was being taken care of by a family, someone that loved me.
They called me at home to see how I was doing. How many doctors do that?
I can remember Dr. Altman calling me on a Friday evening, and I didn't quite recognize her voice, and she said, "Who else would call you to wish you Shabbat Shalom?"
I can't say enough about how fantastically reassuring and caring she was. She really was treating our entire family. That's how it felt to us.
It is incredibly exciting to offer a patient a novel drug that works. There's no happier time than when you can tell the patient that they're in remission, than when you tell them that they're cured. And very frequently the reason those people are alive and live a full normal life is because of the novel therapies that we're offering to them. But before anybody would be willing to support any kind of project, there got to be some amount of data to prove on some level that this concept is functional. And I think ICRF provides that support to young scientists. Many of the drugs that we're using in oncology today got their start for projects like that.
When I heard that I was cancer-free, you just have the moment of you can't believe it, and you can kind of let go.
I think that I am cured and that I can have whatever kind of life I want to have.
It is incredibly humbling to know that you've helped someone through a very challenging time.
I think many people go into medicine for various reasons. intellectual stimulation, ability to understand the world, the mechanism of the disease. But what gets me out of bed is the fact that Mrs. Smith needs to make it to her grandson graduation, and another patient is waiting for the birth of their grandchildren. My job is to return patients to their normal life. That is what I need to accomplish.
I have received many gifts in 34 years, but Dr. Altman and Dr. Frankfurt are definitely at the top of those gifts.
It brought me back from feeling that I was going to die in a month to 4 years later. I'm a couple of weeks away from being 70. What they've done for me is a miracle. They gave me that 4 years.
And I certainly couldn't do it without Dr. Altman. If I'm around today, it's just because of her. I owe my life to her.
And I know that without them, I wouldn't be here, I wouldn't have a baby, and I wouldn't be living a happy, healthy life. So I'm here because of God, family, friends, prayers, and amazing doctors.